Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about an interesting study that kind of brings a lot of stuff together and tells us some more important factors of the different COVID vaccines and how they have an impact on mortality. Because all we've really heard is that they may lower the risk of death from COVID. But we know that there's potential side effects to these, even though we largely ignore them. But that's the reality, is that there are. And these probably sit in the cardiovascular realm. So somebody who may be really prone to cardiovascular issues or clotting may have a potential downside to this. But again, it's not something that we've liked to talk about. And so this review done out of the Netherlands, looking at both the adenovirus vectors, so you've got Johnson & Johnson, AstraZeneca, and they looked at the different studies they looked at included 122,000 patients, and then the mRNA, so largely our the Pfizer and Moderna, and those included 74,000 patients, so these were pretty large. Despite that, the number of deaths in these studies were really pretty small. And so in the mRNA studies, there were 61 deaths, 31 in the vaccine group and 30 in the placebo group. And in the adenovirus group studies, there were 46 deaths, 16 in the vaccine and 30 in the placebo groups. So a couple things to kind of tear apart on this. Well, first of all, the numbers of deaths were really infinitesimally small. And we've always talked about the vaccines protecting against death, but even with or without the vaccines, there wasn't a whole lot of death occurring in the studies that they looked at. They broke them. What was interesting is they broke these deaths into COVID deaths, and then the mortality included non-accident, non-COVID deaths. So kind of teasing these apart, looking at, well, gosh, maybe it protected against COVID deaths, but what about overall deaths? And it turns out that they were actually just one higher in the mRNA vaccine group, which then gives us no argument on death. In these studies looking at 74,000 patients, there was no difference in death between the mRNA vaccine recipients and the placebo. Now, COVID deaths, yes, but overall deaths, largely cardiovascular, they were equal. So you can certainly argue that those are, like, there may be mitigating factors, but it's an important component to look at and one that we have largely been avoiding. However, in the adenovirus vectors, so the Johnson Johnson and AstraZeneca, that was quite a bit different, where there were only 16 deaths in the vaccinated group versus 30 in the placebo group. Again, small numbers, but that argues that there was an overall general protective effect of the adenovirus vaccines. Now, this is not the first time we've seen that. We know that with BCG, the Bacillus like for tuberculosis vaccination, that has an overall immune stimulating effect that leads to better outcomes from a lot of other things, not just from TB. And again, it's a little bit confusing because both of the adenovirus and the mRNA viruses function much the same, even though the adenovirus ones are a little bit more complicated, but clearly there's a difference in them, which then raises the question of what happened to the Johnson & Johnson and AstraZeneca. It's kind of like VHS and beta. Like, maybe beta was better, but we just kind of threw it out because VHS was better marketed, had more money to spend on promoting, and we're starting to see a pullback from Johnson & Johnson here in the United States. When looking at studies like this, they may end up being far more protective in the long run than the Moderna and Pfizer. So just wanted to point this information out because it's very interesting, and only time will tell what all of this is going to look like. But again, in the mRNA vaccine studies that they looked at, over 74,000 patients, there was no difference in death between the there wasn't COVID, but not overall death in the vaccine versus the placebo group. And if there's a downside to the vaccination, then we have to look at it from that standpoint. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.